Do you want fuller lips? Well, filler can help you get there. And I'm going to show you a procedure so you can see how easy it is to get them done. So we have got a Juvederm product that is special for the lips, and we're going to go ahead and inject them. All right, so here we go. We have iced, and I'm going to go just along her vermilion border, 1, 2, 3. So if you just want a natural look, or even if you want a little bit more than that, we have total control of how much filler we put in there. So it does not have to look dumb. It can look very, very pretty and very natural. And you can see how that just perks up. The other thing that lip filler helps with is the lip lines right above the lip too. Open up a little for me so I can just get to that corner. Here we go. Oh, a little la la la. She's doing great. So lip filler can last anywhere from 6 months to a year. I have a lot of people that will come in every 6 months just religiously, just to put a little bit more in because they look so darn cute when you get them done. Let's do the bottom lip too, and then I'll come over the other side.
Open.
We're gonna go, yeah, you're right, like that is perfect. 1, 2, 3, here we go. You are so strong, good girl, okay. So, and you can see right away what they're gonna look like. So that's nice. So if you see that you feel like, okay, I'm done, then we stop putting any more filler in. You can't really overdo it as long as you're watching. And I always give patients a mirror so that way you can see what they look like right away and decide if you want any more at the time. So they will swell for the next couple days though. So today they won't be that swollen, but tomorrow they will be. And I'm gonna move to the other side. I always warn people, if you have something that you somewhere you want to go tomorrow and you don't want anybody to know, today is not the day to do your lip filler. But if you have somewhere you want to go and you want people to know, then today is the day. Here we go, this side. You're doing great. And then they calm down in a couple days. So lip filler is made of hyaluronic acid, which is what we have in our skin to begin with. We also have an enzyme that will break down hyaluronic acid, and that is why filler doesn't last forever and ever. But let's go right here. There are other alternatives to filler or complementary treatments to filler. If you have a lot of lip lines, you can easily put a couple PDO threads above your lip, or if you're nervous about doing lip filler, we can put PDO threads actually in your lip. And those PDO threads will help give you volume as well, but it takes time. Right now, lip filler is working right away, so you'll see it right today. The PDO threads take about 3 months to see their final effects. One more here, and you can see. So if you have somebody you're gonna see in the next few days and you really wanna have those luscious lips, you would wanna do filler. If you just wanna work on something over time, then you can do PDO threads. The other things that can work would be plasma pen. It's really great for lip lines. Scarlet, which is a microneedling radio frequency device, which is fabulous for lip lines and under eyes and over eyes. Actually, Scarlet's great everywhere. But you can see how quickly her lips have just come up. They look really cute. Yeah, look at them. They're adorable. Okay, so we want to do a little bit more on this side. And people can be asymmetric, and so we try to make them symmetrical, but if you're perfectly symmetrical, that does not natural either. So I mean, I'm not going for making you asymmetrical, but sometimes we can't get it exactly perfect. We try. There we go. The nice thing is here we have 3 female physicians, and we've all done lip filler on other people as well as ourselves, so we know what it's like to be on both sides of the needle. And out of over 45,000 offices in the United States, we're in the top 1% with how much Botox and filler that we do. So you're in good hands when you come here. Oh, that looks awesome. Let me see you this way. Yeah, so we're gonna wanna do a little Cupid's bow. And I won't forget about down here, but let's just do a little in the Cupid's bow. Ready? 1, 2, 3. Hi, here I am. Little tiny bit. And oftentimes I use a cannula, but this time we're using a needle. And she's doing great. Yeah. So that's pretty. Let's go to the other side real quick. And then we can be all done. What's interesting to note is that lip filler as a syringe is only 1/5 of a teaspoon. So people always get nervous that we're putting a whole syringe in, but it's only 1/5 of a teaspoon, which is not that much. So here we go again. And this filler really can go anywhere. It's it's like a magic eraser. We could put in any kind of line. So we're going to put it down here in this little line right here. So we'll just go ahead and continue onward and do that. Is that okay? Yep. So I'm going to go, let's go like this. 1, 2, 3. You know, this is not a great, easy place to do for you. Alright. But it's nice because you can see how, again, it just brings that right up. And then I would tell her, although this looks great right now, she will want to think about things for the future so that are going to be longer lasting, such as Scarlet, which is microneedling radiofrequency, plasma pen, BBLs, all the other kind of longer term treatments that we do. Because although we want to look good right now, we want to keep looking good for years to come, and those are going to be the things that actually changes our skin from inside out. But filler I love, especially if you're going to go meet somebody you haven't seen in a while and you just want to look fantastic. Do a little filler. I do it like a week before, but you know, just in case you get a bruise, but you know, it's immediate and it makes you happy. It makes me happy. Anyhow, that looks great. Did it hurt much? Okay, and it really helped those upper lip lines too. So they're really cute. I have a little bit left, so we'll do a little bit more in your bottom lip, I think. And let's do just a tiny bit more in that bottom lip here. And now there's lidocaine in there, so it'll be a little bit easier when I go back into these areas. Yeah, pretty. Turn a little away from me. 2 more spots. Here we go again. And a little bit that way. Awesome. And then we're going to go on the other side, and then we'll finish up attacking you. And one more there. Here we go. Oh la 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 la. Alright. So this is moldable for up to 2 whole weeks. So I always remind patients that lip filler is like water on a dry sponge. So if you push on it, you're going to push it right off that sponge. So don't touch it. If you feel a lump or a bump, that's okay. Leave it there. And then if in a week you still feel that lump or bump, then you need to come back to me and I can mold it. But like water on a dry sponge, if you push it today, you're going to push it off the sponge. So don't touch it. And over the next couple days, if there is a little bump, it'll integrate into your skin. So we just want to leave it where it is. Still got one more skosh. Let's go back over here. And as long as you can remember, try not to pucker, try to avoid straws, small bottle tops, any kind of puckering for the next couple days, because you don't want to push that water off the dry sponge. Oh yeah, that looks super cute. Let's just see if there's any left. We'll go one in the middle. We never like to leave any filler behind, so just make sure we don't have any left in there. And there we go. Look at those little smackers. I love them. Anyway, so even when you're putting on like lipstick and stuff, you're going to want to just dab it. And you don't want to mush your lips together for the next 3 to 4 days, because again, we don't want to push the water off the dry sponge. So that's it. I mean, I think you did great, and I don't think you're going to bruise at all.
Good.
So I'm sorry about that.
Good.
Yeah, well, bruises are complimentary, though. We like bruising, but I'm also happy when people don't bruise.